how the session will flow today. We will have about 2 hours for the discussion. We will have speakers and panelists who will present on different topics, and then after each presentation you'll have an opportunity to ask questions, share some thoughts and reflections. So please use our chat. Please raise your hand, and we will definitely give you the floor. I think that's actually all the rules that I was supposed to tell you. So I'm very excited probably to go to our first speaker, Ms. Cristiana Salvi, who is the Risk Communication and Community Engagement Regional Advisor at WHO Europe. And she will kickstart this conversation about lessons learned from COVID-19. I'll give her the floor to introduce her presentation herself. Cristiana, very happy to have you here with us, and over to you.
Thank you, Alha, and I'm really glad to have the opportunity today to be here with you and to talk to you about the role that risk communication, community engagement had in this pandemic. I will share some slides, so I will focus on some visuals for this presentation. And but let me say just at the beginning that I would like to basically focus it on the importance of going local. As here we have experts and stakeholders from regions that make up the network that basically is in focus this week. We want to really understand how much the local level is critical for every emergency. It is where every emergency starts and every emergency ends, and where basically the coordination with all the levels and with the local level in the front line is critical. So I'm sharing now the slide with you, hoping it works, because technology is always a challenge. So I'm asking now, Olha, if you can see that right, or you see in presentation mode?
If you can switch, we can see the whole thing. So if you can switch to the present.
What about now?
And now we're still it's not a presentation mode.
Wait, now?
It's coming once again. Nothing changed to me, so we still see it's not in the presentation mode.
Okay, let me try and share. I mean, this is all the time happening. Okay, I'll try again, and then I'll see what happens. What about now?
Yes, that's perfect.
All right, I managed. I mean, I think that with the pandemic, one of the main challenges I had is really the technology, and we are all dealing with that, considering that we had to reinvent the way we work virtually. And this is actually one of the lessons learned, if we want to look into that, basically the difficulty that we had to go and support countries and regions on the ground, but really all the support that we had to provide virtually. So let me go now really at the core of the presentation. Just to say that my role, as Olha introduced me, is really risk communication, community engagement in health emergencies. And I've been leading the communication pillar throughout the pandemic. As you might know, basically we have a system where there is an incident management support team and different pillars supporting the response. So one of those pillars is the communication pillar that includes both external communication and risk communication, community engagement. So if I now go to my next slide, hopefully, okay, I got it. Now, this is a very bold statement, but we are very, I mean, we really have it on our heart, how much risk communication, community engagement has been high during this response. And I'm seeing this as we are now planning for the next biennium in terms of the resources, in terms of the activities. We cannot really plan based on what we have been doing so far, because the pandemic has really changed the risk communication, community engagement role as a real public health intervention. I think that it has never been so clear that this is the case. I've been working on risk and community engagement for the last 20 years. deployed in the field. And I've been seeing these already in other regions, like in Africa, or in Southeast Asia. But I think that this is now clear to everybody around the globe. And we also know that we need the commitment of the whole of government and the whole of society to have an effective risk communication community engagement. Now, I really want to highlight these as the two key dimensions of RCC. This is the acronym that we call risk communication community engagement. That's for those who are dealing with that on an everyday basis. So on one side, there is the whole of government, and we have seen it also with the COVID. So even though COVID is an infectious disease emergency, the whole of government is involved, all of sectors, but also all of levels. There is a local situation and context we see is the start, but also from the local context and situation, we get an input to the central level. The central level would not be able to understand and to act if without the input from the local context and situation. At the same time, it's really critical that then there is a coordination at the central level, which is multi-sectorial and multi-level. And then it goes back to the local level where operations take place and impacts take place. And then they go back to the central level coordination. So it's a virtual circle that really make the response effective. On the other side, there is the whole of society. It was never so clear, as I mentioned at the beginning, that the people have a critical role in stopping the transmission. And when we talk to people, we talk about community engagement. To do that, we need to make governance inclusive. So really take into account the perception, the behavior, the knowledge of the people, and do that also through the civil society organization. I will go a little bit more deeper on that. And doing that, we really want to increase in the longer term readiness and resilience of the community. We are taking it a step farther from engagement to empowerment, because we really want to make sure that the community participates in the response, co-designing the intervention. Now, I'm sharing this slide to give you a sense of the entire direction that we have been taking throughout these 2 years. And of course, this is the macro level, and we have been developing plans and strategies and tools and guidance and everything you can think of throughout these 2 years. What we have been, wanting to reach in the context of RCCE is this single overarching communication outcome. People who are familiar with WHO might know what it means. It's basically the outcome, the result of our effort, and which is the RCC effort. So what do we want to do? We want the people complying with health protection measures that are recommended by health authorities and protect themselves. And this will contribute to the control of the pandemic. And this has implication at local level. I am looking now at this implication throughout basically this visual, which is basically the matrix at the basis of the work that we have been doing. In the middle, there is the trust. And again, those who are familiar with RCC know that one of the main objectives is really building and maintaining the trust. And there are some capacities that contribute to that. Of course, the first one is communicating early and transparently, and we expect it at the local level, particularly because, as we said, emergency starts locally, but it's very important to coordinate across level and also with the central level. Why? Because consistency is critical to trust. Without consistency, the public will be confused, and there will be, and trust and credibility will be damaged. The other element is listening. What we have been trying to do, and again, we have seen that it has never been so strong in a response. The listening function through formative research, behavioral insight, social listening has been very strong as the basis of communication. And of course, the local level is in a great position to understand the local insights, also through mechanism of local outreach. At the same time, the community engagement component is really working with local influencers and local channels. And this is, of course, the local stakeholders have a big role in that. Now, why going local? Well, we know, of course, there is proximity to communities, knowledge of communities, flexibility to change also according to the evolution of of the pandemic and the situation, mediation of conflicts that can arise in situations like the pandemic, connection to influencer members of community, understanding of who they are, and engagement of the influencers. And of course, participation into decision-making processes at the local and at the central level. So really, local authorities have a big role in reaching out to population group and strengthen community readiness and resilience. Now, I understand that I have only a few minutes left, so I will go very quickly through the tools, some of the tools that we have been developing to support the work at the country and local level. These are tools that have been developed to understand the insights, the listening tools, and the testing tools. And that we can, if you have questions on those, we can go a little bit deeper on the understanding. It's about understanding the insights, it's about monitoring media and social media, and it's about testing messages. This is an important app that we have developed together with UNICEF, translated now in 20 languages, that basically provides accurate information to the users, and also is an opportunity to understand what are their opinions, perceptions, and rumors. So it's a great tool that we have also embedded in Ministries of Health website, and is available to be used also by local and regional authorities. This is just another element to share with you that we have been adapting and translating materials in 40 languages to make sure that the penetration at local level happens. And this is just a snapshot on the tailored training packages that we have been offering so far on many issues, including RCC, infodemic management that is emergent during this pandemic, communication for healthcare workers, for contact tracing, journalists, spokesperson, and social media. We had 40 webinars last year and this year. And what is forthcoming is a new breakthrough 10-step capacity building package taking stock of the pandemic lesson that is available to everybody who would like to implement. Let me just go to the last slide of this part, and then I'll ask if I can have 2 more minutes. So I just wanted to highlight who are the key influencers that we have understood are critical to get the trust of the people and influence positive behaviors. You see them listed. And I think that, again, local authorities have a fundamental role in engaging with them for inclusive governance at the local level and to coordinate with the central level. This is an initiative that we are putting particularly in place, engaging the civil society organization. We have basically engaged 8 projects in different member states to reach out for vulnerable groups and working directly with civil society organization to make a change and to really work bottom up. It's a new way for WHO to work, and I'd be happy to explore more with you during the next couple of hours. And again, local stakeholders can make a difference to engage, to enable, and to empower. Now, Olga, do I have 2 more minutes, or you suggest that we skip this part and we go to the next presenters?
I think you have two more minutes, but I also want to encourage the participants to type their questions into the Q&A box, please. And yes, please go ahead, Christiana.
Yeah, I will really take 2 minutes. So I just wanted to present you the new campaign that is going to run between November and April. And it's really a novel way, a new narrative on COVID-19. So we are seeing now 3 big challenges. Variants of concerns are spreading. We have big gaps in vaccination, and countries or people are easing on their public health and social measures. So in particular, we see that there is a lot of focus on vaccination, and particularly the debate on vaccination, but at the same time, there is not much focus on social measure, on protective measures. And actually, there is a perception from people that public health and social measure equal restriction, while we really want to encourage people to understand that these are the way to avoid the restrictions. So basically, we are launching a new campaign where we want to rebalance vaccination and public health and social measures. So a new narrative where we want to maximize the acceptance of both and make people understand why these measures are needed, also when you are vaccinated. We want to use more evidence to show the positive impacts of this measure. When we talk about this measure, we talk about the social measure like washing hands or wearing a mask or keeping distance. But we also talk about the public health measures, which are implemented by governments and the regional authorities, which are the contact tracing, the testing, isolation and quarantine. We want to really explain that they're not legal lockdown, but a way to avoid it, and especially frame it as enabler for people to go back to freedom, and enabler for government to relaunch their economy. This is really my last slide. We want to put communities at the core. As during the regional committee this year, it was very clear that one of the lessons learned from COVID is that communities are at the center. So what we are trying to do is really to zoom in priority countries and the local context and co-design the intervention with them, adapt and tailor, and engage local influencer and partner with the communities. And of course, translate into relevant languages. So it's just a snapshot of the new campaign. And again, happy to answer any question or elaborate a little bit more as you wish. So this is really the last slide. And I thank you for your attention, and thank you all for the extra 2 minutes.
Thank you so much. And before we go to the Q&A, I just want to correct myself. Unfortunately, we only have 1 hour, not 2, as I said before. So that's why we also give our presenters no more than 10 minutes. We have a few questions. So Christiana, a question, unfortunately, I cannot see who is asking that, but if you could maybe elaborate on what exactly can be done at the local level, how that the work would look like ideally.
Yeah, no, that's a great question, and actually is the core of our discussion. So I think again, when we talk about operational response, I think that this really happens at the local level. I mean, there's no other level that is better positioned to understand the communities, to liaise with the community. So, and I think mapping the influencers is critical, and engaging them, mapping the vulnerable groups, those that are hard to reach, and identify which are the best way to outreach them. Because at the local level, I mean, when I listed the key influencers and those that are very much trusted, I think the local authorities are really in between those who, I mean, rule and those who can influence positively, because local leaders, local authorities are more trusted at the local level. So I think they have a very important role in supporting the messages coming from the central level, in coordinating with the central level, but then making I mean, really the response operational at the local level. So I think we can expand a little bit more on that when it comes to, I mean, the discussion later. But I think when it comes to identifying the communities, so mapping them, identifying the influencer, message testing is also incredibly important. Engaging also with the journalists at local level, because when we have the big article that go international, that normally work more at the advocacy level. But when it comes to influencing and engaging the community, you need to engage the local journalists, you need the local bloggers. And this is also what local leaders can do. Use social media as an important platform to get out to the community. So again, with the coordination, because again, we need to ensure the consistency with the central level, the local level are really in a best position to reach out and to influence.
Thank you so much. And another question is from Bettina. So she's asking, well, she's saying that there is a lot of requests for capacity building and capacity strengthening at the local level, and whether there are going to be any summer, winter schools that the regions can also participate in and sign up for, where we will speak particularly about how to communicate health beyond even COVID.
Yeah, that's another very good question, Bettina. Thanks for asking that. We are really investing into capacity building. We actually were considering having a summer school, and we will think through more about that. For the time being, we have an RCC compendium. So basically, we have a number of trainings that have been developed specifically on COVID-19 And we are developing now a 10-step capacity building package that will take stock of all the COVID response. Actually, we had before a package that has been implemented in 20 countries, but now we are basically revamping it through the pandemic experience and relaunching it in early 2022. And there will be opportunities, of course, for the regions, because what we want to ensure when we propose to countries for implementation is that also the regional levels are included, because unless we have this coordination between levels, the response will not be effective. So we will work on three fronts. One, the capacity building for COVID specific. Two, the possibility of a summer school end of training specifically for the regional level. And three, pitching to country level the 10-step building package, including the regional level.
Great, thank you so much. And we have this third question, and after that we will move to the next panelist. So Ashley is asking whether we see any increased adherence with protective behaviors when local identity is built into campaigns. For example,
I mean, you're getting all the key questions. So thank you, Ashley, for asking that. We are basically also looking very closely at monitoring and evaluation as a central piece of all our campaigns. And I think this has never been done the way it's done now with this pandemic. M&E has also always been considered an important element, but then mainstreaming it has been very difficult. So we are developing a very strong methodology for M&E, which we are going to apply in the new campaign that I just presented, where the new campaign is basically the focus of the new campaign is country and community specific. So I'm not able to answer your question now, but we are building a baseline based on the data that we have available, based on epidemiological data, vaccination coverage data, public health and social measure data, behavioral insight data, and social listening data, to understand where we stand and to understand to which extent the campaign can make a difference with the involvement of communities and local level. So this is coming, but I think you made a very important question, because this is the core. I mean, unless we are able to monitor and evaluate what we do and understand what progress we are making, I mean, our efforts will go spray and pray, but will not be really giving us the feedback on the impacts that we are having on the ground.
Thank you so much, Christiana, and we will move on, but I really hope that we will have a remaining time for the discussion with everyone at the end of the session. So unfortunately, today, Mr. Eugenio Santoro couldn't join us, but we now will go on to the representatives from the regions, and I'm very excited about the upcoming presentation. We will have Mr. Giorgio Merlani, Chief Medical Officer from Department of Health and Welfare of Canton Ticino in Switzerland. And he'll share his experience and expertise on public health communication in Ticino during the crisis and beyond. Over to you, Giorgio.
Thank you so much, Olga. Thank you, everybody, for participating to this session and for the invitation. I was told I have about 5 minutes to talk. I guess we can make it maybe 6 minutes because there is one panelist missing. But I think I don't need much more time. I go to sharing my slides. Should be this one. Okay, you should be.
If you can maybe move it to the presentation mode.
Yeah. I hope it works, because I have 2 screens and this does actually not work for me. Do you see it?
Yes, everything's great.
Okay, it's not fine for me, but when it's fine for you, it's fine. It's okay for me. So let me briefly introduce myself. I'm the Chief Medical Officer in Canton Ticino. I was told I have 5 minutes to talk about, and I should make my presentation very, very local and try to make it somehow personal. Let me start with going back to February 2020, when we all had to face the beginning of the crisis. As you know, Ticino is very far away from Wuhan, but it's very near to Codogno, which was one of the first region outside Wuhan, which was very hardly hit. So in Ticino, which is the southernmost region in Switzerland, a very small canton, we are the only Italian-speaking part in Switzerland, and we only have 350,000 people living there. So we are in a federalistic country. We have to manage the health system by our own. We have contacts to Italy. We are near culturally to Italy. We hear what's happening in Italy, but the system works on Switzerland. So we had a very peculiar situation because we were one of the first regions which was not really overwhelmed by the crisis, but we were confronted with the crisis which was coming because it was very near to us in Codogno, and we only had a few days, few weeks to get ready to prepare ourselves to try to face the crisis. So as you can imagine, there was a lot of surprise, a shock, fear. There was no time to handle it. The only thing that we knew is that a new disease was coming. We know very little about this new disease. There was missing evidence, and all we knew is about what we usually know about infectious diseases. You have susceptible, you have infected, you have recovered, and the maths we did was showing us a heavy crisis hitting Ticino. So what was very important for us was to get the population informed. We tried to control the fear, to inform and then to instruct the citizen so that they will try to behave in a correct way. Our way to do this was through a very rapid, very transparent and accessible communication. We tried to be understandable, available to everybody so that the citizen would act in the proper way. The second step was when we were in the crisis. The virus had arrived already in Ticino. The fear we had was to have an overcharged health system, and we had to try to prevent this overcharging the system. There was a growing knowledge about the disease, and what we had to decide in these days was to prepare the decision. What was peculiar in Ticino, that it happened all to be together. What I mean by this is that the political system, the government, and the health authorities were making shared decisions and were communicating these decisions. And that was, in our opinion, a very good way, because those who took the decision communicated straight to the population what the decisions were and what the countermeasures were to adopt. We also had in these weeks the opportunity to communicate straight, direct to the population. We had daily communication on television, on streaming web media, and so we were really near to the population. And what was a little bit peculiar in this phase, let me talk about a fun factor about this history, is that the health authorities, myself, became a campaign in this crisis. We were daily on television, and then we realized what Dr. Salvi was telling before. The authorities were really local, near to the population, were the reference point in making decisions, but also in communicating what was the right behavior to adopt. One situation more in this peculiar situation in Ticino was that I got myself also sick in this period. So I had to stream the information to the population that I was sick, because since I was daily in television communicating what the evolution of the pandemic was. Since I was missing, I had to tell the people why I was missing. And the truth was that I got sick myself. So the goal in this phase was to get the community engaged, not only to adopt the right behaviors, but also to participate in trying to reduce the infections, to reduce the risk of overcharging the health system, and also to try to help each other, because we know in the crisis there were more fragile people than others. In the third phase, that's what I could translate into the harvesting of the trust you could build during the crisis, because as you all know, this is a very difficult phase. The crisis seems far away. The community has somehow faded away. There is back the individual in the center of the crisis, and there is also everything is only about discussion and arguing between vax, no vax, liberty, too much liberty, not enough liberty, and the empowerment of the citizen has turned into a kind of cacophony where everybody feels itself especially entitled to talk about the crisis. And so this is the moment then you have to use the trust you were able to build up in the months to try to continue to endorse the measures, to go on with distancing, hygiene, wearing masks, but also about vaccination. And this is also important not only for managing the health crisis, but also in trying to reduce the conflict to help accelerating the crisis. About the question before, how can we measure what was the way we try to communicate with our citizens? We don't have studies yet, but what we can see is that the population in our canton, since they only hear communication in Italian and were instructed by health authorities, by myself, since we are so a small community, we have seen that there were conflicts between people from Ticino and people from the rest of Switzerland when they met, because the adherence of mask wearing, hygiene, and social distancing were much higher in Ticino than in the rest of Switzerland, which is a good news about the adhering, the right behavior, but is a bad information about the living together from Ticino and the other cantons. So I hope I was not too long in my presentation. I can go back from.
That was perfect timing. Thank you so much.
Okay, I'm trying to interrupt the condivision. I hope it works.
Yes.
Okay.
So I don't see any questions yet in the chat. Please put them in the chat. But I have one myself. So thank you for sharing. That's very actually exciting. And indeed, what Christiana was saying, we suggest to do, and what we know that is contributing to building trust. You've done so many of those things, and it's really impressive. I was wondering if you have any actually lessons learned, like looking back, if there is something that you wish you would do maybe differently, or we need to make a note for the next health emergency, that this is something that we should change or we should keep in mind.
I think what we should keep in mind is what we did with this sharing of information from the technical, scientific point of view with the political point of view. That was really important on both sides. Let's then talk afterwards, if you want, what this means in the future, because we could use this crisis also for many other issues about climate change and so on and so on. But the politics were so without any information about what to do that they were relying on information from the health authorities, and we've seen that worked. We, on the technical level, could talk to the politicians straight on a daily basis. That was our daily job. That means daily from Monday to Sunday in these weeks. And those who took the decisions, shared the decision, were communicating also the decisions. And that's much more working much better, because if the chief medical officer, but also if the Minister of Health goes there in front of the public and tells, so that's what we have to do now because we know this and that, that seemed to me that it worked. And I would use this in the future also. What we have to find to change for the future is to try to shift from this way to act on what we are doing now in a smoother way. I think there was suddenly a kind of cut during summer when politics realized that the technicians, the health authorities, the scientifics became much too popular. It became also a problem because you become a celebrity on your level. There is only 300,000 people living there. Once you get out of your office, you meet people in the road. That's incredible, but it's also dangerous.
Thank you so much, Giorgio. I see a hand from Christiana and some questions in the chat. Christiana, over to you. No, we can't hear you.
Yeah, I'm muted, of course. I was saying that it was really inspiring, Giorgio. And I really would like to hear, you mentioned this trust at the center, and you had a lot of trust because you mentioned that the work you did really brought to adherence to this measure more than in other areas. Do you feel you had the trust before the pandemic? Did you manage to build the trust before? Or it was the opportunity of the pandemic that people were really concerned about the risk, that they were trusting the authorities more? How do you feel you have established this trust?
Very difficult to say. I think it's a mix of both. I don't think you can step into the office the day before and then start talking about. I'm doing this job since 12 years, so I'm already a known face, I guess. I guess that the fact that my specialist is ID, infectious diseases, helped in knowledge, bringing the knowledge, and the citizen understood quite fast that you know what you're talking about. That's also important. The trust is also based on competence, and I think the people understands this quite fast. And I also think that one of the main issues is to be there all the time, and to be the trust is also admitting when you don't know. You have to know, we don't know what's coming. We don't know when it's coming. We don't know how hard it is. But what we know is wash your hand, stay safe, and so on. And they start picking those small things which are clear. And then when you start saying, now we know you need masks, then they start putting them on because you did not say it before. You did not just try to share knowledge that you don't have.
And thank you so much. And speaking of masks, we have also a question from Ashley on that. He's asking, how do we help build the norm of mask wearing? People should feel proud of their efforts, not uneasy. Do you have any suggestions on that?
That's a strange story about the masks. I think we could do 3 days talking about this issue. We didn't have masks. We did not have any scientific evidence that masks really help. We could guess, but we did not really have an evidence. And now we have to convince people that they should wear masks. I don't know. I think it will come. It already is. I mean, think back a few months ago, meeting somebody with a mask was something strange. Now you even meet people driving alone in their own cars wearing a mask. So I think it's not only becoming a kind of social norm, it's becoming maybe something absolutely normal. Also in the future, I guess, like a little bit like Southeast Asia, they're using masks if they have sneeze, if they have any respiratory complaints.
Thank you so much. And a very quick last question from Bettina is on how many professionals were trained on communications? within your team, if I got it correctly.
What do you mean by trained?
Trained to do communications?
Well, we had communicators helping us, but they were not physicians. We had physicians not really trained in communication. For me, it was a little bit learning by doing. It was also some courses, some lecture about what you should learn, what you should do, what you should say and not say. And it was also trial and error, because mainly at the beginning, there was a lot of mistakes worldwide, I could say, but we had also our small mistakes here, which we did, which we learned from. And I hope we don't repeat in the future, but I'm sure we will.
Thank you so much. Thank you,
you.
Giorgio. Great to have you with us, and a very interesting and inspiring conversation indeed. And now I'd like to give the floor to Dr. Ashley Gold, Head of Behavioral Science at Public Health Wales in the UK. I'm looking forward to hear your insights on applying behavioral science to the pandemic response. So over to you.
Great, thanks, Ola. Can you hear me?
Yes, please go ahead.
Good, great. Thanks very much. So thanks very much for the introduction and the opportunity to share our learning around applying behavioral science. I think it follows on from Giorgio and Christiana's presentations. So if I can get the slides to work, sorry, there we go. So I think WHO recognized the application of behaviors as a way of controlling the pandemic, and we have as well, and that's recognizing that no one acts or behaves then rationally all of the time, and we need a way of coping with that to optimize the effect of our communications and our services and policies, and that's very much what behavioral science has been about. So we've deployed it over the last 18 months in a way that hopes to elicit, enable, and encourage very specific behaviors that we've been talking about as a group in very well-defined target populations, again, which we've been talking about as a group. The way that we've enacted that in Wales is through a risk communication and behavioral insights subgroup. So this is an advisory group that connects, as with Giorgio, straight into Welsh Government, into the politicians. This is a group of academics, public health experts like myself, government technical advisors and communication leads. Public Health Wales is an organisation that I'm involved with, has contributed guidance on using behavioural science in COVID communication specifically. And I've included a short link there to the guidance, and it's in the footer as well. And the core of that guidance is stuff that we've been talking about on this in this session. So a three-step process really of identifying the important populations and the important behaviours, and then describing that target behavior. What do we actually want people to do? Not necessarily a policy outcome, but a very specific behavior. And then identifying and describing the population segment of importance, maybe by age, sex, geography in the way that Christiana was talking about, or by job or psychographic contingents as well. And we do that to identify, as I say, important populations and important behaviors. Second step then is to really get behind the factors that influence those behaviors. Ideally, we would do that through engagement, but we've seen in the pace of movement, of response that's been needed, we might need to do that by just thinking actively around this, by walking in their shoes or reflecting critically on interactions that we've had with those specific populations in the past. And to do that, to identify the barriers to the behaviors that we would want to see. We do that systematically by using the COM-B framework that I'm sure colleagues have come across. That's around gaps and priorities in terms of people's capability, their knowledge, their skills, and their abilities. There may be gaps in terms of their opportunity to enact that behavior, environmental problems and issues, or there may be social problems and issues and norms for them. Or it might be in terms of motivation, their belief in how important or how normal this behavior is, and whether it's going to do anything anyway, and whether they've got established habits either in the direction of that behavior or against it. So we unpack in that way, and then we use that to plug the gaps. So where are the gaps in that COM-B framework, and how do we best enable, elicit, or evoke the behaviors that we want to see? Is that through education? Is it through incentivization? Is it through training? Is it through restructuring the environment that we've seen a lot of through COVID, or is it through modeling the behavior that we'd want to see? And we do it particularly in communication by using obviously powerful message that are salient, talks about reward in the way that Christiana talked about, using the right messengers, showing and role modeling the behavior, and the formats and channels are correct for that audience. So that's the core to the guidance that we put into the system in Wales. And two examples of some of the outcomes that we've, the way that that's shaped our communication. So firstly is around young people and the way that we honed the messaging on for that group. So the insight was about that group more than any other, probably wanting to get back to their way of life. An example here in italics of the way that we put that messaging together. So having a COVID vaccine is the best way to get back to the gyms and the salons and having drinks with friends, the things that are important to that group. And there's a benefit to carrying out the behavior that we want, COVID vaccine on that one. The difference that, recognizing the difference that young people are making. So if we all get our vaccines, the need for lockdown goes down. So they've got a vital role and a vital contribution to make in that space. Protection of others is important for young people as much as it is for people of my age, perhaps. So we wanted to identify that. So actions, their actions of young people protect others. Vaccines will help keep our society open and protect livelihoods, immediate return for that group of individuals, possibly less than infection for those individuals, because that's clear throughout the pandemic that they would be less likely to be infected. We picked up specific concerns around side effects. There might be a barrier for some young people, so we addressed that. Most side effects are mild, they only last a few days, in comparison to long COVID that can last a lot longer. So we're using the insight to shape the messaging. And we built on, as Giorgio referenced, we built on trust, and we built on the application of the question behavior effect as well. So thousands of young people and social care professionals, we used a young social care professional to do some of this messaging for us as a key influencer. They've had their vaccine, they think it's important, and they hope that they get yours too. So that's an example of some of the messaging. And what's your number one reason? We put that out there as a question into social media to elicit responses. Another area then is about the way that we've deployed that approach to communication is in relation to equitable vaccine uptake. So at the moment, we run at about 90% uptake of primary and secondary jabs, jab 1 and 2, in the adult population in Wales. So we are very much now focused on no one left behind and specific groups and specific barriers that we need to fill. We've deployed the WHO's increasing vaccination model that unpacks these behaviors. It deploys the COM-B framework, particularly for vaccination. And you can see some of the elements that I referred to on that slide before last in that graphic. So we are focused at the moment on activity of those that are yet to attend. I don't like to call them do not attend or have not had, because I think that everybody is open to this, and we need to focus on their potholes to attend in. We've got a specific concern around vaccine uptake in pregnant women that we are working on. And at the moment, we're focusing on 12 to 15-year-olds and trying to optimize vaccination uptake in that group. So very much about targeted communication, those important messengers and important influencers, particularly in social media channels for the younger groups, thinking about the language and tone to minimize psychological reactance to what we're asking people to do. Normalization that we brought up in another conversation on identifying and amplifying the reasons that people have got, what are their beliefs and their motivations. And we want to make this behavior of vaccine normal, easy, attractive, and routine. So I mentioned the risk communication and behavioral insights subgroup. They've also issued some guidance. I'm a co-chair of that group, and we've issued guidance on sustaining, so looking forward, sustaining COVID safe behaviors. And I've included here a reference to that, short reference to that guide as well, that's available online. Some principles that we've pulled together and learning out of the back of this, and it's included in this guidance. No such thing as a neutral message. So we've got to be really careful and cautious about the information that we put out. We want people to listen to it. We want people to take on board what we're saying and then act on that. We've got to think about those pathways that come from our message. The best way to address that, obviously we talked about this as a group already, is the co-production and build self-relevance to individuals. Alongside that is building intrinsic motivation, so inclusion of the why Why are we asking people to undertake these behaviors, and maximize the rationale in our messaging? So this is about transmission prevention. It's about keeping life going, holding on to those gains, protecting the things that we've won as a collective, if you like, to get back to nearer to normal. And I've mentioned deploying the question behavior effect as well. So questions are a lot more powerful than direct instructions in many cases. Another underpinning principle is the celebration and emphasis on the collective effort, the shared identity and collective responsibilities and goals that we've got. The way that we can use national identities and local identities to really consolidate behavior and show that it's normal. And we frame in terms of collective care and concern, and in collective and personal gains as well, and not restrictions. And we've talked about that previously. And the normalizing of behavior as an underpinning principle. So lots of people like me do things like this all of the time. That's important underpinning principles. So we've drawn that kind of content together and those principles together, but we are recognizing the finite cognitive resources that we've all got. And Giorgio mentioned fatigue within this. I think there's alert fatigue, particularly in Wales. So we've pulled together a COVID code that presents the messages in a way that we are hoping can be more widely adopted, and Welsh Government have taken this on board as a code for people to identify with. This is very much about the Swiss cheese model. So every slice, every step in here counts. It's not one thing that's going to solve this. Is, as Christiana has described, it's very much about the whole thing. And as I say, we're trying to push the marketing of this with Welsh Government to get this into lots of places that people could see that this is normal to follow. And a final slide on our ongoing learning. It's about helping people to identify the challenges and how they would overcome them, particularly in high-risk scenarios. It's about better habit creation and how we can communicate in that way to create mental models and encourage repetition. So leaving face coverings near your house keys, take your mask with you every time you leave the house, those kind of mental schema to help people think through. And using public declarations and commitment devices on certain personal protective behaviors could help. But the last bullet then is about our key learning is about the science and the speed are the two keys that we've picked up. So segmentation, recognizing the mix of cognitive, psychological, and social and environmental influences on behaviors, and constructing and testing interventions is the way forward. And then in terms of speed, it's how quickly we react and respond, sharing the load, using multiple insight and evidence sources, as Christiana has described. And our underpinning sort of approach to COVID communication has been in those 6 circles at the bottom, about using messengers, including the why to motivate, checking people's knowledge, using social norms to leverage behaviors, using questions to evoke and elicit as opposed to instructions, and having simplified and attractive messages. So thank you very much, Jill.
Thank you so much, Ashley. Thank you. That's very exciting. And I'm really sorry, but we have only 5 minutes left. And I have many questions to you as well. But if I can give the floor to our last but not least panelist, Olga Dobrovidova from the European Science Journalists Federation. And then I hope that we will have a few more minutes for questions to both of you. I'm really, really sorry about that. Olga, please, over to you.
Thank you, Olga. Hi, everyone. I'm going to try to be brief so that we do perhaps have a moment for questions to all of us, really. So I was asked to present some takeaways and some lessons for science journalism for the pandemic, and I'm going to stick with 3 for this session. And my first takeaway is that we have to acknowledge that we were not having it easy before COVID. As an industry, the global transformation of media markets, the challenges to the business models, to freedom of the press, and fundamentally to the trust our audience had in journalism, really had been in the picture way before COVID hit in January 2020. Some of these processes, such as the shift towards the freelance economy in journalism and the rise of brand media and corporate communication disguised as journalism, posed a particular risk in light of what was about to come. So in a way, the pandemic has catalyzed some of these processes, and we will see who ends up emerging the economic winner on the other side of this. One thing is clear though, as the Reuters Institute research has suggested, The pandemic and the ensuing infodemic made our audience turn to trusted news sources, which were able to increase their numbers, their audiences, and actually bumped up the average trust in news overall. So it turns out that when push came to shove, journalism was there, providing accurate and balanced information to support decision-making. My second takeaway has more to do with how science journalism specifically fared during the pandemic. And I think we've had what I call our safety net really tested and pushed to the limit by the upheaval in science itself, first of all. Science journalists have had to reinvent the way they were working with peer-reviewed publications and preprints when the latter became increasingly important in COVID communication. Some of us, including journalists in the US and Russia, have had to struggle with inconsistent or non-existent communication with the government and a lack of transparency that really made our jobs that much more difficult. We've often had to take up the mantle of experts ourselves, helping our audience navigate the uncertainty and the ever-shifting landscape of COVID research. And again, some of us have had to stop whatever we were doing before the pandemic and switch gears completely to cover the coronavirus pandemic with the little resources that all of us had. And I have to say at this point that I'm proud to be part of a global effort to help journalists across the world cover the COVID-19 pandemic and the vaccination effort that WHO also supported. A colleague of mine, Mary McKenna, once said that reporting on the pandemic is kind of like going to a disaster zone to work and then not being able to come back and put it all behind you because the whole world is a disaster zone, including your home. I think that's not what most of us had in mind when we decided to become science journalists, but apparently, according to another report by SciDevNet, it takes a little more than a global disruptive event to sway us off our professional course, as 8 in 10 science journalists surveyed in that report still want to stay on the job in the next 5 years. And finally, the third takeaway is kind of forward-looking. In the words of Ed Yong, who's a staff writer for The Atlantic, who received a Pulitzer Prize for his explanatory COVID journalism, science touches everything and everything touches science. What I personally take that to mean is that in this era of global challenges of all sorts, science journalism should be bold and arguably even bolder in engaging with matters where our expertise, our skills, and our dedication to our audience may be useful. And it's not just about public health, which is an obvious option here. I can think of another omni-crisis that will require a world-scale societal response in this century. And science journalists, of course, have been leading the way in covering climate change for the last few decades. Of course, it is worth mentioning that despite all of our best efforts, the pandemic is still ongoing. It's still not over yet. So we'll see whether I will have to amend this very short list. But as we're used to saying in journalism, please stay tuned. Thank you.
Thank you so much. This is very brief and very insightful, and I'm really grateful for that. We have a question, actually, I think it's to Ashley. And Ashley, if you can be very brief, that'd be great. Actually, I had the same one. So does society accept your advice? Maybe you had this example with youth. So how did you measure whether the messages had effect that you expected? 30 seconds.
Same as Christiana and Giorgio, really. I think we're in a process of measurement. I think they're really difficult causal pathways by saying this message caused this behavior. That's really difficult. I think you can test them in small scenarios, but the evidence is if you co-produce, they're more likely to be accepted. I think what we've got overall is high levels of adherence to personal protective behaviors still in Wales. And I hope that our approach has contributed to that.
Thank you so much. Thank you. And I also have a question to Olga, and thank you so much. I was wondering if you can give a brief advice how the local level we can engage with science journalists or with media in general more effectively. What would be your?
Well, I would say that the first thing, and this is something that a lot of science journalists actually mentioned, is being open and transparent about the activities that you're doing. As the more journalists know about this, the easier it is for them to create a balanced and fair picture of what's going on the local level. And then it's all about capacity building, right? Because for instance, in Russia, most science journalists are actually working on a national level. So it's important to create the infrastructure. I mean, it's more of a peacetime effort, but even during the pandemic, it's still important to create this infrastructure to help journalists working in local outlets, or not science journalists per se, but as we often say, everyone is a science journalist now.
That's great. Yes, indeed. Thank you so much. And I think there is another question to you from Christiana. In the long term, it would be great to keep protective measures like hand washing beyond COVID, because it's saving lives beyond COVID. But we see adherence waning as measures are lifted. How do we do that? How do we promote protective measures from your point of view? Olga, that's to you.
That's to me. I'm sorry. I was thinking. I guess one of the challenges that we still have to figure out as science journalists is how to separate the work that we have to do from really basic, from basic measures that are supposed to, I guess, have to be covered in high school, really, in schools and the education system. So I guess that remains to be seen, how we integrate the really useful measures that will keep saving lives into our coverage. I don't really have an answer for you here yet.
Yeah, that's a good question.
Olya,
Yes.
Bettina speaking here. I'm deeply sorry. The other 2 sessions are finished and they're waiting in the lobby for you to reconvene and to merge with the remaining team. Is that okay? Please go over to the plenary where you were before. Okay, everybody listening. And then we hope that in the plenary, we can continue with some further questions. I hope you all have the link to the earlier plenary. Olga, you do. If you, just a second, I will inform in IT here so that you get it. Okay?
Yes, thank you so much. And many thanks to everyone. I'll see you.
Super thanks for the efforts. Great discussion, really. I would have liked to stay another 3 hours to go into the depths. Yeah. Thanks.
Thank you. See you.